Do your ankles swell so much by the end of the day that you can barely bend your foot? I'm not talking about mild puffiness after a long flight or a busy day. I mean legs that feel heavy like stone, skin stretched tight, socks leaving deep marks that stay for hours. When you press your finger into your ankle and the dent just sits there, that is called pitting edema. If this is happening to you every evening, listen very carefully because this kind of swelling is not harmless. It is not just discomfort, and it is definitely not just cosmetic. It is a loud warning sign that your circulation is failing in the lower half of your body. When fluid pools in your ankles and lower legs, gravity is winning. Blood flow slows to a crawl. Oxygen delivery drops. Waste products build up. The veins become stretched, weak, and lazy. This condition is called venous stasis, and venous stasis is dangerous. It creates the perfect environment for deep vein thrombosis, blood clots that can travel to your lungs or heart and become life-threatening. This is not a skin problem. This is a vascular problem. Most people are told the same useless advice. Elevate your legs, soak your feet, cut salt even more, and yet the swelling keeps coming back. Why? Because you are only treating the visible symptom, not the nighttime process that actually causes the fluid to stay trapped. Tonight, I'm going to give you the complete 7-step bedtime vascular protocol. Not something you do during the day, not something you remember once a week. This is a targeted nighttime fix that works while you sleep. We are going to drain the fluid, strengthen the veins, and force circulation back to normal before your head hits the pillow. If you do this correctly, you will wake up with lighter legs, flatter feet, and shoes that actually fit again in the morning. And I need you to pay very close attention to step 7, because step 7 is the clinical secret. A natural compound vascular specialist used to repair vein walls from the inside. Do not skip it. Let's start with the internal foundation. Most swelling is not caused by salt alone. Edema happens when your electrolytes are out of balance, specifically sodium, potassium, and magnesium. Your kidneys depend on the correct ratio of these minerals to regulate fluid. When potassium or magnesium are low, your cells hold on to sodium. And where sodium goes, water follows. That water ends up in your ankles. So 1 hour before bedtime, we begin a cellular fluid release. You will prepare a simple mineral drink. Magnesium citrate is the first ingredient. Magnesium relaxes smooth muscle, including the muscles in your blood vessels. It allows veins to open and fluid to move. Use roughly 300 to 400 milligrams of elemental magnesium mixed into a full glass of water. Now here is a secret addition: potassium bitartrate, commonly called cream of tartar. Potassium works inside the cell. Sodium works outside the cell. By increasing potassium, you send a signal for your cells to release excess sodium and water. Add a generous pinch, about a quarter teaspoon, to the magnesium drink. Sip it slowly 1 hour before sleep. This timing matters. You want your kidneys working on fluid removal while you are still upright before gravity stops helping you. If you have kidney disease or are on potassium-altering medications, consult your doctor first. For everyone else, this is the foundation. Now that your system is primed internally, we move to the physical reset. Swollen veins become overstretched. They lose tone. They stop pushing blood upward. We fix that using controlled thermal shock, a powerful vascular reflex. You will need 2 basins, one with hot water, as warm as you can safely tolerate, the other with very cold water and ice. First, place both feet in the hot water for 3 minutes. This causes the veins to open wide. Blood and trapped fluid move toward the surface, then immediately switch to the ice water for 1 full minute. This is uncomfortable, and that's the point. The cold forces the veins to clamp down hard, squeezing fluid upward and out. Repeat this cycle 3 times. Finish with cold. When you remove your feet, something remarkable happens. Blood rushes back in. Fresh, oxygenated blood replaces stagnant fluid. This is the fastest manual way to decongest your lower legs before bed. We have flushed the system. Now we use gravity correctly. Lie on your back near a wall. Slide your hips close. Lift your legs straight up so they rest against the wall. Your legs should be higher than your heart. Now, here is the mistake most people make. They just lie there. That's not enough. Every minute, point your toes upward for a slow count. Then flex your feet back toward your head for a slow count. This activates the calf muscles, your second heart. Do this 10 times per minute for 5 minutes. This pumps fluid out of the ankles and into the central circulation. 5 minutes equals a full lymphatic drainage session. Non-negotiable. Next, we strengthen the vessel walls themselves. Fluid leaks out because capillaries become inflamed and porous. We use a targeted botanical massage. Mix cypress essential oil and rosemary essential oil into a carrier oil. Cypress tightens vein walls. Rosemary increases local circulation. Massage from toes upward toward the heart, never downward. This reinforces venous return and prevents fluid from settling again. After the massage, we lock in the results, but not with heavy compression. Never sleep in high-grade medical compression stockings. Instead, use light compression socks, the kind used for travel. Gentle pressure maintains drainage without restricting flow. If the sock leaves deep marks, it is too tight. Finally, we stop the habit that ruins everything. Drinking late at night. Large amounts of fluid before bed will always settle in the ankles. Stop drinking liquids 3 hours before sleep. Give your kidneys time to work. Now comes the most important repair step. Horse chestnut seed extract combined with pine bark extract. This combination seals leaky capillaries and strengthens veins from within. Taken at night during deep sleep, when the body repairs tissue. This is how swelling improves long-term, not just overnight. One last warning, do not cross your legs. Crossing clamps the main return veins. Use a pillow between the knees if you sleep on your side. You have now learned the full 7-step nighttime vascular reset. This is not a trick. This is applied circulation science. And if you want to understand the foods that are destroying your vein elasticity every day, the next video explains exactly that. Now there is something very important you need to understand. If your ankles swell every evening, this is not just about fluid. It is about pressure. Inside your veins, there are tiny one-way valves. Their job is simple: push blood upward and prevent it from falling back down. But when veins are overstretched day after day, those valves stop closing properly. Blood leaks backward, pressure builds, fluid escapes into surrounding tissue. That is chronic venous insufficiency. And once this process starts, elevation alone will never fix it. This is why you can lie on the couch with your legs up for hours and still wake up swollen the next morning. The veins are weak. The valves are failing. The system is broken. This is also why swelling often starts in one ankle first. One vein fails earlier than the others. Now here's the part most people never hear. Nighttime is when venous damage accelerates. When you lie flat, blood redistributes. Your heart rate slows, muscle pumps shut off. If your veins are weak, fluid seeps out all night long. You wake up with stiffness, heavy feet, tight shoes. That is why everything we do must happen before sleep. But there is one habit that silently cancels all progress: sitting. Long evening sitting, watching television, scrolling on your phone, sitting with knees bent for hours. This compresses the veins behind your knees near the popliteal veins. They are the main exit route for blood from the lower legs. When they are compressed, fluid has nowhere to go. If you must sit in the evening, straighten your legs periodically. Stand up every 20 minutes, do 10 calf raises. Movement is medicine for veins. Now let's talk about why swelling is often worse in warm weather. Heat causes veins to expand. Expanded veins leak more fluid. This is why summer swelling feels unbearable. It is also why hot baths before bed make edema worse. Warm feet feel relaxing, but they open leaky vessels. Cold tightens vessels. Cold restores tone. That is why the final cold step in the contrast bath is critical. Never skip it. Now I want to address a dangerous misunderstanding. Many people think swelling is only a heart problem. That is not true. Heart failure can cause edema, yes, but most ankle swelling in older adults is venous, not cardiac. The difference matters. Heart-related swelling usually affects both legs equally and comes with breathlessness. Venous swelling often starts asymmetrically and worsens with standing. But here is the danger. Long-standing venous edema increases heart workload over time. Fluid overload strains the heart. Blood volume rises. Pressure rises. What starts as a leg problem becomes a heart problem. That is why early intervention matters. Now let me explain why step 7 is non-negotiable. Horse chestnut seed extract works by sealing capillary junctions. It reduces leakage at the microscopic level. This is not symptomatic relief. This is structural repair. Pine bark extract protects collagen. Collagen is what gives vein walls strength. Without collagen support, veins stretch permanently. Together, these two compounds restore integrity to failing vessels. That is why vascular clinics use them. And this is why taking them at night matters. During deep sleep, inflammatory signals drop. Repair enzymes activate. Blood vessels rebuild. You are supporting your body at the exact moment it heals. Now let's talk about what will sabotage everything if you are not careful. Sugar. High sugar damages blood vessels. It stiffens capillaries. It increases leakage. If you eat sugar late at night, insulin spikes. Insulin causes sodium retention. Sodium pulls water into tissue. Swelling worsens. This is why dessert after dinner makes ankles worse by morning. Alcohol does the same thing. Alcohol dilates vessels and blocks fluid removal. If swelling is severe, alcohol must go. Now, a critical warning. If your swelling is sudden, painful, red, or one-sided, stop. That is not simple edema. That could be a blood clot. Sudden swelling with pain or warmth requires immediate medical attention. This protocol is for chronic, nightly swelling, not emergencies. Now I want you to understand something empowering. Edema is reversible. Veins respond to training. They respond to pressure changes. They respond to mineral balance. You are not broken. Your system has been overloaded. And now you are unloading it. Tonight, if you follow these steps, you will already feel a difference. Within a week, shoes fit better. Skin feels softer. Indentations disappear faster. Within a month, veins regain tone. But consistency is everything. Miss nights, swelling returns. This is maintenance turning into repair. Now, before we end, I want to ask you something. Have you been told swelling is just part of aging, that nothing can be done? That is not true. Aging weakens veins. Yes, but weakness is not fate. It is a signal to act. In the next video, I will show you the 3 everyday foods that quietly destroy vein elasticity and trigger inflammation. Foods almost everyone eats thinking they are healthy. If you want lasting results, you need that information. Subscribe so you do not miss it. Your legs carry you through life. They deserve proper circulation. Start tonight. If you do, your mornings will change. And once your circulation improves, everything improves. Before you turn this off, I want you to pause for a moment. Think about how long you have been dealing with this swelling. Months, years, maybe even decades. Most people quietly accept it. They buy wider shoes, they avoid walking in the evening, they stop traveling, they stop enjoying simple things. But swelling is not just discomfort, it is circulation under strain. And circulation affects everything: your heart, your energy, your balance, even your brain. Poor venous return means poor oxygen delivery. It means more inflammation. It means higher pressure on your heart over time. This is why fixing your legs improves far more than your ankles. Now let me explain what happens if you do nothing. Fluid continues to pool, veins stretch further, valves fail permanently, skin becomes fragile, discoloration appears, wounds heal slowly. This is how venous ulcers form, and once ulcers appear, recovery becomes difficult. That is why the goal is not just reducing swelling tonight. The goal is restoring function. That is exactly what this protocol does. Each step has a purpose. The minerals rebalance fluid at the cellular level. The temperature contrast retrains vein tone. The muscle pump restores upward flow. The oils strengthen local vessels. The gentle compression protects overnight progress. The fluid cutoff prevents gravitational pooling. The botanicals repair vessel walls from the inside. Nothing here is random. This is vascular physiology applied correctly. Now, let me be very clear about one thing. You do not need to do this perfectly, but you do need to do it consistently. If you miss a step occasionally, that is fine, but skipping everything and hoping swelling resolves on its own will not work. Your veins need guidance, they need structure, they need nightly support. Now I want to address a common fear. Many people worry this means they will be tied to a routine forever. That is not true. In the beginning, this is nightly. As your veins strengthen, swelling reduces faster. Over time, some steps can be reduced, but repair always comes before relaxation. Now, I want you to imagine something. Imagine waking up and standing up without stiffness. Imagine putting on shoes without resistance. Imagine walking in the evening without heaviness. That is not unrealistic. That is normal circulation, and it is achievable. But only if you act. Tonight. Not next week. Not after another painful day. Tonight. Before you finish this video, I want you to commit to one thing. Choose a bedtime. Set aside 30 minutes. Prepare your minerals. Prepare your basins. Prepare your space. Your body will respond faster than you think. Now, one final and important reminder. If your swelling is associated with chest discomfort, sudden breathlessness, or rapid weight gain, seek medical care. This protocol supports venous circulation. It does not replace medical evaluation when warning signs appear. Use wisdom, use awareness, but do not ignore your legs. They are speaking to you, and now you finally understand what they are saying. In the next video, I will reveal the everyday foods that quietly damage vein elasticity and keep inflammation active. Foods that cancel all your hard work if you are not careful. That video completes the picture. Subscribe so you do not miss it. Take care of your circulation. It takes care of you.